Good afternoon. Thank you all for joining us today. We appreciate you coming in and taking time from your busy days to be a part of our meeting. Today, the agency is going to be talking about our preparations for the end of the COVID emergency, the COVID public health emergency. You'll often hear this referred to as a PHE, which is public health emergency. So if you hear PHE, just want to avoid some confusion on that. So my name is Melanie Cleveland. I'm Communications Director with the agency. And I will be talking to you a little later about communication efforts that we've had going on within the agency and what we're planning ahead. But before I get started on that, we're going to have Commissioner Azar share a little bit with us. Before she comes up here to share some opening remarks and information, I do want to get some housekeeping items out of the way. First of all, if you've joined us virtually, all of your lines have been muted. We just ask that you keep those lines on mute throughout the presentation to avoid any disturbances. We also ask that you utilize the chat box to record your attendance, put your name and the organization that you're with in the chat box at this time to let us know you're attending. If you've joined us by phone only, you can email your attendance. And the email address to send that to is meetings with an S, meetings@medicaid.alabama.gov. Also, today's meeting is being recorded, so we will have a recording posted on the agency's YouTube channel, as well as a link placed on our website that you can access both the slides and the recording in the future. So during today's meeting, you're going to hear from Alabama Medicaid's Commissioner, Stephanie Azar. She's going to give some opening remarks and just give us a little bit of background, where we've been and where we're heading in the future. I'm also going to share some information, if you haven't heard it already, about the Yellow Postcard campaign and the COVID toolkit, communications toolkit. And finally, we will have Gretel Felton, our Deputy Commissioner, who will share about unwinding approaches, validations, and anything having to do with the beneficiary services. We also will have Marie Dean, who will talk about training if anyone wants to become an application assister to help Medicaid recipients either renew their coverage or get signed up. You can learn about that application assister training. So without further ado, I'd like to turn it over now to Commissioner Azar.
Thank you. Well, good afternoon, everyone. It's a pleasure to be here today, and I'm very excited to see that we do have a lot of people joining the call today, which is really good news. It was really important for me to offer up an opportunity like this to all the stakeholders and everyone to be just aware of what we are doing as regards to our unwinding or winding down of PHE when it will end. And today is mostly to talk about primarily the eligibility side of the ending of the PHE, not our services side that we do. There'll be more information on that will be up and coming. So as most of you know, March 13th of 2020, the national COVID-19 public health emergency began. So we've been in this public health emergency for a good little while now. And that Medicaid recipients have maintained coverage for that whole period of time during the PHE, which, as many of you know, we referred to as the maintenance of effort. We cannot take anyone, cannot come off that program unless they have been asked themselves to be taken off, they are deceased, or they move out of state. On July the 15th of this year, the PHE was extended by President Biden, or the HH Secretary under him, and I feel fairly certain, due to the Biden administration having let us know that they would give the state 60 days notice, that's Alabama and all other states, 60 days notice before they would end the PHE. So we keep on our calendar, what date is the 60 days before? Because if we don't get that whistle to let us know it's ending, then we feel pretty secure that they're going to extend it for another time period. So that would mean that we do anticipate, from what the Biden administration has told us, that the PHE will be extended beyond the October 15th date. Now, they could choose to end it anytime after that, but generally they call it for 90 days. And if that happens, it would roll over to some period of time in January, early January. So we'll just have to wait and see if they end it before that January cutoff, or if they don't, or if they extend it. We really don't have any information further than that. The end of the PHE basically means, from the eligibility side, that we've got to redetermine coverage for recipients who have now maintained coverage for over 2 years. And when we say maintain coverage, there are some individuals who would otherwise not be eligible and on the program if not for the maintenance of effort that has them remaining on the program currently. So the preparation for the end of the PHE, for those of you who do not know, is referred to as unwinding. We're going to be unwinding these individuals back off the program or realizing that they are still eligible. So we want to make sure that that's a very important component for sure. So it is referred to as unwinding by the federal government, and that's how we have conversations about it. My staff is in routine contact with CMS in regards to unwinding. And the unwinding plan, we actually have to have a plan with CMS in regards to this, which is important. So we are doing that. So we brought all of you here today, which was very, very important to me and our staff, because it's not one, so that you can know what we're doing. What are we doing? Because it is our number one goal to ensure that we conduct unwinding properly. And when I say properly, I mean in the rules and regulations and the guidance that CMS is going to expect us how to do this. And basically, they're giving us about 12 months, plus 2 under circumstances. It could go as long as 14 months to unwind the individuals off this program. And we want to make sure that we do our due diligence in every way absolutely possible to ensure that someone who is otherwise eligible for our program does not get taken off. So that's kind of where we are with it. And your part is going to be extremely important, because most of you see our recipients in person on a regular basis. And what we need you to do now for us, if at all possible, I challenge each of you, is to please ask each recipient when you see them to update their information with Medicaid. Because we routinely see, and as many of you know, if someone's changed an address, they've moved around, and we don't have the correct address, and we're doing unwinding, after so many notices, we're going to have to take them off the program. And we don't want to disrupt or cause any coverage problems for anyone that is otherwise eligible for the program. And some of these individuals we have in the maintenance of effort, number of folks that we have in there that we're estimating, probably became ineligible at some point, stayed on for the MOE, and have since again would have otherwise become eligible. So we just really want to protect that and not take anyone off who would otherwise be on the program. So we would ask that you give a simple message that you could communicate to our Medicaid recipients, which is to tell those recipients they need to keep their addresses and all other contact information up to date with Alabama Medicaid so they can receive notice about the time to reapply or when their benefit changes. So and Melanie and others today will be giving a lot more detail on our yellow card campaign and all of those things. I think it's just very important to know that you guys we see as being the first line of being right there with our Medicaid recipients. So it's very, very important that if there's any way that you can help us, we would greatly ask that you do, and you always do, so I feel confident in that. So I want to welcome everybody to the call. I hope today will be very productive for you, and there'll be a question time at the end that the staff will be able to help you with. And I just thank all of you for being here today and for so many showing up to hear what we have going on. And I hope you all have a great day. Thank you.
Thank you, Commissioner Azar. We appreciate you sharing this information and elevating the importance of the messaging. There are so many times you can look at a message and not realize how important it is just because it's a simple message. So that's where this comes into play. In communications, we have been putting out a very simple message. And I'm going to get to that slide here, the yellow postcard campaign. The reason we did yellow is it's bright and cheery and it's eye-catching. And these yellow postcards are designed to go in all provider offices, pharmacies, public health departments throughout the state. Anywhere that a Medicaid recipient is visiting on a regular basis, we're hopeful that they will find these yellow postcards and grab their attention. There's a QR code at the top of these yellow postcards. And these are designed not for the recipient to take home with them, but only to be posted in those provider offices. So if you can help us out, we do have these available for download on the website. We also have our academic detailers who are going out and visiting provider offices. They may not have gotten to your office just yet. So we just ask that you go ahead and visit the website and download the file so that you can print these cards and post them in a really visible place that a Medicaid recipient could find it in your office. The idea is to go ahead and get that address up to date as soon as possible. And I do want to step back here and take off my non-Medicaid glasses. Before I came to Medicaid, before I was communication director here, I was not knowledgeable of where to find information or how to update an address on our website. It's not as easy as you think. So it's not just a matter of filling out a change of address card. There are certain steps that a recipient has to go through in order to update their address. So that's why we did these yellow postcards, is to explain all the different ways they can do this. Now, it can be as simple as a recipient picking up the phone, calling that recipient call center line, and updating their information verbally. That is definitely an option. There's two other ways, though. They can go to the My Medicaid portal or the CARES portal, and they can log in with their information. This would have been the same portal when they filled out an application. If they applied online, they already have their username and password from when they applied for Medicaid online. So they can definitely go back into that portal that they applied originally in, and they can change their address there in the portal. The third option is to fill out a Form 295. We call it Form 295 because all of our forms are numbered, and Form 295 is recipient change form. These are available on our website. It's a little bit laborious to try to get to it on your own, so that's why we've included it on this yellow postcard so that recipients can easily find that form, click on it, print it out, or you in the provider's office. We would love it if you could assist your recipients by printing out this form. If they're filling out a change of address for your records in your doctor's office, most likely they need to fill out a change of address for Alabama Medicaid as well. And it is so vital, so important that they get these updated addresses to us so that when the PHE is ending, we can turn around and get them their renewal packets or even change of benefit notices. If there's any changes to the benefits they're currently receiving, they need to be notified. We want to make sure they're utilizing those added benefits if there are any. So, simple message, vital message. And we just ask that you as you as providers and partners with Medicaid would download these, print them on yellow paper, put them out there. If you don't have the capacity to download it and print it, get in touch with me in my communications office, and I will be more than happy to send you some of these yellow postcards directly through the mail. Oh, and I do want to back up here. At the very bottom of these yellow postcards, we have put some information about text notifications. We have both a recipient text list and a provider text list. So if you, as a provider, have not joined that list yet, and you want to receive updates by text message, we only send the most vital information. We don't bombard you with text messages every day or even once a week. We only send a text message when it's needed. We don't sell your information. So if you subscribe, you just put in the phone number 888-777, and you go to the body of your text message and you just put in keyword AL Providers with an S. AL Providers, all one word. And if you send that to us, you will get subscribed to text messaging. You'll find out about meetings like today and other provider meetings that are coming up. Now, recipients, we want to ask them to go ahead and subscribe to the recipient list as well. Recipients can get notification on a global pattern. It's not like an individual text message they're getting that they need to renew. It's in general, okay, the PHE is going to be ending soon. We need to make sure your address is up to date. Click here to update your address. So, simple messages shouldn't take up too much of their data. One message every once in a while shouldn't be a problem for most recipients. So the next thing I want to highlight from communications is we do have a communications partner toolkit. And the reason this was created is because we have a phased messaging or phased key messages. Phase 1 is what we're in right now. Phase 1 is simply update your address and other contact information. We want to make sure we can get in touch with you whenever we have important information to share with you or it's time to renew. So that's the get ready, phase 1. Second is check your mail. In phase 2, but this is probably going to be introduced somewhere when you hear the end announcement of the PHE. So when HHS or federal government says, okay, we're ready, we're going to end the PHE on this date, we're going to move to phase 2 because then some things might start going to recipient mailboxes. And we want to make sure that they're watching their mailbox, completing any information, any forms or surveys or reading any letters that come from Medicaid at that time and getting information back to us as soon as possible. And then phase 3 is obviously renew. That's when they get their renewal packet. Now keep in mind, a lot of our recipients have had coverage for 2.5 years. Some of them didn't know they continued to have coverage. Some of them kept the coverage, but they didn't know why. So we just want to make sure it's clear that that coverage will not continue once the public health emergency ends if they've not taken any action and they needed to renew. So another part of this toolkit is information about application assister training. You're going to hear a little bit more about that from Marie shortly. But we also include frequently asked questions. So if there's any questions that we're hearing over and over from either providers or recipient groups, we're going to start including those in the FAQ section of this toolkit. So it's a work in progress. I encourage you to continue to check back, look at the website when you find information on there about what our current messaging is. So I do have a link at the top of this next slide. And whenever these slides are posted to the website, I encourage you to download these and save them to your desktop and share them with all of your staff. I think every provider, as well as their staff, need to understand why this messaging is important. If you think about it, your first contact with the Medicaid recipient in your provider office is your receptionist. So I'm hopeful your receptionists can hear this messaging, understand how important it is, and that they'll be able to turn around and obtain that information or tell that recipient how they can update their address. So the first link you see on there is for providers, and all of the information we've discussed, the download of the English version as well as Spanish version of the yellow postcards is available from that link. You can also get the toolkit from that link. Today's meeting announcement was placed on that page as well. And if we do any future provider meetings related to the COVID unwinding or the end of the PHE, you're going to see that posted on that first link. So I encourage you to bookmark that particular page, that very first link on the slide. The rest of the links are related to recipient communication. So I'll let you guys, when you get these links when you go onto our website and you get these links, I encourage you to go through and click through those and look at all the information that we've put out there. We've tried to make it all inclusive, separate for providers and recipients, because the recipient messaging is written very differently than how the provider messaging is. Okay, and now I will pass this along to Gretel Felton. Gretel is our Deputy Commissioner, and she's going to talk to you about eligibility processes through the unwinding.
Thank you, Melanie. And yes, I'm the Deputy Commissioner for Beneficiary Services, which means eligibility. So I'm over the eligibility offices throughout the state that handle this unwinding process. And what we'll be doing is renewing everybody. So Melanie, I think, and the Commissioner explained mostly what unwinding is. Unwinding is we're winding down from the PHE, and we're redetermining people to see if they're still eligible for Medicaid. Because as she said, there are a lot of people that stayed on who were not eligible at the time of their renewal, and we normally would have cut them off of Medicaid, and they're still on. I'm sorry, I don't know how to do a control of this gadget. So what is our approach? There are many approaches. Different states are taking different approaches. Some states are trying to determine who they think would most likely be ineligible and try to get them off first. Other states are saying, okay, that's a lot of trouble. Let's try to do the renewals as they normally happen, and then they will drop off when they're ineligible, and we'll do it that way. So there's so many different approaches that states could use. What we're doing is called a hybrid approach. And the hybrid approach that we're using is necessary because we have so many different eligibility groups. One, the biggest group that we have is children. Children under 19, that's our biggest eligibility group. Now we could do children first, But the children are on the application also with the parents, with the pregnant women, with the Plan First recipients, and with the people that are on transitional Medicaid. So you have a whole family on that application. So you can't change the renewal date for that one person, and it is going to skew the application process. So those groups are what we call the modified adjusted gross income, or the MAGI groups. So we will probably, in our hybrid approach, go ahead and renew them at their regular renewal date, and then see who's ineligible and who's eligible. Another thing that we'll do is we will transition individuals to a different eligibility group if we find them ineligible. That's called an ex parte determination. If possible, there may be some groups that we can prioritize. We have a large group of people that we feel like are ineligible because they are on a Medicare savings program, and we already know their income is over the limit for that program, or for any eligibility program for that matter, and they may be prioritized first. We continue to work on our renewal process and what we're going to do, because every month it changes. Some of the people come back on another program in the meantime. Others have changes in eligibility, and that's why this communications outreach is so important. Because as they come in and let us know their changes, then we may be able to now redetermine them for another group through our ex parte, and then they will not have to be in the unwinding process because they'll be on our regular Medicaid. Another thing that I want to mention is that even though we're doing this unwinding, it's all about renewals. It's about people who are already on the program, already been determined, and every year they have an annual renewal, and we have to determine whether they're eligible for that program still or for another program. We still have Medicaid applications coming in every month. So my staff will have to do those renewals as well as those applications that are coming in. And so it takes as much, or actually it takes more effort to do an application, but it's not even considered in the unwinding process. So we still have all of that extra work to do as well. And then there's the groups that we have. I'll say that, I said that our largest group is children. Our largest groups are all of the MAGI that I mentioned first: the children, the parents, the pregnant women, the Plan First individuals, transitional Medicaid. Those are MAGI groups. We also have Medicare savings, which I mentioned. Those are people that are on Medicare, and we're paying for their premiums, and we're assisting by paying for their Medicare enrollments. But we also have some more difficult cases, which are home and community-based waiver cases, and our nursing home or institutionalization cases. Those cases require not just income determination, but they also require resource determinations, and they are more difficult. So we really have to make sure that we consider them because of the difficulty of those cases. So it usually takes more for those, and we probably will need some additional help in getting those cases done. And for that reason, we are looking at ways that we can augment our staff through retired state employees, through contractual means, that we can get additional staff, mainly to help with that group, because we will have to do applications and renewals for those groups. So the last thing is that there's a special consideration for the SSI population and the DHR population. SSI population is probably the biggest factor. Is probably the second largest group of what we call unwinding people. In other words, we already know they are not eligible for SSI anymore, but we still have them on due to COVID. So they're the third largest group. But anyway, the difficulty is that we don't determine their Medicaid eligibility. The Social Security Administration determines their eligibility, and all we get is information, data that's sent to our system letting us know that they're no longer eligible and the main reason that they're not eligible. So there's not anything in our system except the last thing that Social Security sent us. So we have to be very careful. We'll have to have more outreach to them, and this address campaign will be more important for that group because we'll need more information. We have a checklist that we will hopefully send out to them, and we have started sending out to them so that we can gather more information to try to see if we can go ahead and place them in another eligibility group, because we cannot redetermine them for SSI. That's only the Social Security Administration that can do that, but we can put them on another eligibility group if they're eligible. So that group is going to give us some challenges. So I think that our main focus will be on what can we do to make sure that we correctly renew these individuals. And when I say renew, actually we're saying ex parte, which means that before we terminate. I know I'm giving you all this eligibility jargon that you really don't want to know. There's also special consideration for our DHR children, and those are children that are in foster care or adoption. We have a way of ex parteing them to something called former foster care, so that would be done for those individuals. I want to say that normally we have three things that we have to consider. We're doing a big project, especially when it's an IT project. So I got this from my IT friends, and our Deputy Commissioner for IT is sitting in the back. So you can have three things: fast, right, or cheap. But you can't have all three. If it's fast and right, it won't be cheap. If it's right and cheap, it won't be fast. If it's fast and cheap, and that sounds great, doesn't it? It won't be right. So that's our dilemma, and that's why we need extra help. And I'm going to tell you about some of the help. We need help because when we're doing an eligibility determination, people may not know what we have to do. So first we have income validations. These are the types of things that we have to look at. We have to look at income. We have SSA tax data, unearned income, IRS real-time employer data through the federal hub, child support enforcement data, state data exchange, VA, DHR, and that's just the short list, okay? Citizenship and identity. We have to go through the Homeland Security, U.S. Immigration, SSA over and over again. They have a lot of data. Veterans benefits, VA, Paris, Public Assistance Reporting System, Medicare, SSA, and the Medicare database, birth records through vital statistics and other means, death records through SSA, vital statistics, address validations, third-party insurance, eligibility in other states, verification of disability, which is a very big process. So all of those are validations that we have to do. We also have to do for the elderly and disabled, aged, blind, and disabled, as I said, they are more difficult. We have to do resource validations. So my staff has to look at bank accounts. We have to go back 60 months of bank accounts to see if anyone has transferred assets. Other financial accounts like IRAs, 401ks, mutual funds, CDs, automobiles, trailers, motorcycles, boats, motorized vehicles, stocks, bonds, promissory, I know I'm giving you a headache now, promissory bond notes, property, mineral rights, timber rights, trusts, annuities, insurance policies, livestock, equipment, any resource that can be converted to cash. Now, after all I've said, do you think this is a daunting task? Probably so. So what we've done is we've asked for some waivers from the federal government to make it easier on ourselves, and so that we can get the task done, to be honest, because this is a very big task. So we've had a state plan amendment request, and this request has not been approved, so we're still waiting to hear from the federal government. We're requesting 12 months postpartum coverage for pregnant recipients. We asked for it to become effective October 1. However, as I said, it has not been approved yet, so we're still waiting on approval for that. We have also asked for some waivers from CMS. They're called 1902 E14A waivers, and they are part of Section 1902 of the Social Security Act. That's what that means. So this waiver gives us approval to do some things that we normally would not do in our redetermination. The first one is we've asked for and been approved to do a renewal for certain individuals based on SNAP eligibility. So what we will do is thank you. I'm sorry. We've asked for a renewal based on SNAP eligibility. That waiver will be for primarily pregnant recipients, recipients on Plan First, and children under 19, which is our biggest group. We also have asked for renewal based on TANF eligibility. For our low-income parents, if they're eligible for TANF, then they would also be eligible. Now, for our children, actually, if they're eligible for SNAP, TANF, or both, they would be eligible, and for our pregnant recipients. We've asked for something called an ex parte renewal. What that means is, let's say we check eligibility on all of those databases that I said, and nothing comes back, okay? Well, normally, if nothing comes back, and they say that it looks like they have no income, we have to find out, well, why is it that you're saying you have no income, or how are you handling your finances, paying your bills, and that sort of thing. And that's what the federal government would request, but they're waiving that for now. And so we can, if nothing comes back, we're good to go. We don't have to check further. And states are kind of hesitant to do that without a waiver. A lot of states say, okay, we've got to find that out. And then some of them make them sign a waiver saying that, but now we don't have to do that. Something called a facilitated renewal also for the individuals. Remember all those assets that I told you had to check for? So what this does is, if we put in the information and we don't get any information back on our asset verification system within a certain time frame, we can say, okay, that we're good to go on that, because they probably just don't have it, because the asset verification system usually brings back verification of the assets. And then there's another waiver that we may need, basically depending on how many people are requesting fair hearings, is to possibly extend the time frame for fair hearings to take action on those. So how are we going to do that? I've mentioned the ex parte renewals, but there's from the E14 waivers, but there's some other ex parte renewals that we will be doing as well. So there, as was said earlier, we have not terminated anyone from Medicaid. So there's a group of kids that we have on Medicaid that normally they would go from Medicaid to all kids because their income was over the limit. But because of the pandemic, we could not terminate them from Medicaid. So at the end, those children, if their income is still over the limit, would be transferred. So let me make that clear. We can't just do all of these things. We still will have to send a renewal packet for everybody to see if they're eligible, except for those on the E14. So we would still have to send a renewal, and it might turn out that now they're back on Medicaid. So we're not just going to flip people because what happened during the pandemic. We will still send a renewal to everyone. We also have something that we do in Alabama called the RRV, which is an automated system of renewal through the federal hub. We will continue those, and that's going to help us quite a bit as well. I think I said before, if we have children that are leaving foster care, automatically we will go ahead and provide them former foster care. We will have automatic transition from one Medicare savings program to another. There are several Medicare savings programs that provide different benefits based on income. So if their income has gone up, we'll just take them to the next Medicare savings program if they're eligible. And then we have a group of people that are on SSI. They're no longer actually eligible for SSI, but they're in the nursing home or in a waiver. So my staff will redetermine them for Medicaid in a nursing home or in a waiver. Because on SSI eligibility, the way that they got eligibility in the nursing home or waiver was automatic because they were on SSI. But now we have to redetermine them for that different program. So those are some of the things that we're doing. The other part of that is we will need some type of enhanced staffing assistance. So the first thing we'll do is try to fill as many vacancies and constantly fill vacancies quickly as they occur. I'm not good at this. Sorry. Possibly use contractual assistance to process cases, and we are working on that. Also, with the fact that we have the All Kids program using the same system, is that when they make determinations, it will affect Medicaid, and when we make determinations, it will affect all kids because we do the determinations and the system says whether they're going to be on Medicaid and all kids. So that will help us as well because we have their assistance in using the system and they're getting these application renewals as well. And the use of application assisters to assist beneficiaries. Marie Dean is going to tell us a little bit more about that application assister process, and that's where providers can come in and assist us with the applications. At Medicaid, this has been a great team effort. At the top of that, I will have to say the IT department, and as I said, there's a deputy commissioner right back there. There's also our deputy commissioner over at analytics back there, and they help us quite a bit with the numbers and letting us know who's in what group and what's going on. We also, and the communications department, as I said, human resources, trying to get positions filled as quickly as possible, transferring positions as we need them, working with analytics. That's very helpful. So we know who is on what group and what we can do. The ACHNs are very helpful in letting us know what's going on with the recipients, getting their address changes, getting any other changes that are going on with them. Project management keeps us on task extremely well. And then the legal department, whenever I get too excited, sometimes they will rein me back and say, you can't do that, but we'll tell you what you can do. So I certainly do appreciate this team effort. I hope this has helped you in knowing what we will do. And I guess at the end, we'll be happy to answer any questions that we can answer. Thank you very much.
Good afternoon. I'm Marie Dean. I'm the Associate Director for Training, and I'm going to give you a little information about application assisters and during the unwinding, how we would benefit from assistance from other agencies to help our Medicaid eligibility specialists to get these people back on and determine again for their Medicaid program. The application assistance program is basically you going through a virtual training with me. Usually lasts anywhere from an hour, 30 minutes to an hour. In this process, you will learn about Medicaid programs that you will be assisting with. You will be given an overview, excuse me, of our policy for our different Medicaid programs. Basically, the duties of the application assister is to assist individuals in applying for Medicaid or being redetermined for Medicaid, one of our Medicaid programs. You can assist them through paper applications, or you can assist them through our online applications. As I said, the training is usually 30 minutes to an hour webinar. Once you go through the process, then you are asked to complete a security agreement and a short test for about 10 questions. And it's basically the information that we've gone over in the training. Once you've completed and have turned this information into my office, to myself, then you will be given a certificate of completion. Your certification is good for 2 years from the date of the training and a 2-year period. After those 2 years, you can come back through and you can do a retraining. The retraining basically consists of us just reviewing changes that may have occurred within our Medicaid policy. If you would like to sign up, my information is here on the screen for you. You can email me or you can give me a call. One more thing I want to say, once we start our training, again, it doesn't take long, it's not hard. We do have about 400 plus application assisters throughout Alabama. We do work with hospitals, maternity care clinics, recovery centers, any agencies that are assisting our applicants who are in need of Medicaid assistance. Any questions that we may have?
Okay, Marie and Gretel, thank you so much for sharing that important information. Appreciate that. And at this time, we're going to go ahead and open up for questions. The first question that I see in the chat box is, what information does the recipient need to have in order for the application assisters to help with renewal? And secondly, there was a bunch of questions that came in. I did see something asking if the application assister position is paid. So I'm going to pass this over to Marie. What information does the recipient need to have in order for application assisters to help with the renewal?
Basically, as an application assister, you're just assisting. If they need to apply for Medicaid benefits, if they've been to your facility and they need medical assistance, you're basically helping them fill out an application. All information is based on self-attestation. So it's basically, again, a paper application being completed or helping them through our online applications, through our care system. There is not a fee to become an application assister. Basically, it's on a voluntary basis.
Thanks, Marie. The next question, when do you plan to start the unwinding process month before PHE ends, the month it ends, or the month after? I'm going to let Gretel answer this one.
Okay, first of all, the Centers for Medicaid and Medicare Services, CMS, will let us know when the unwinding period starts. Now, when the unwinding period starts, we'll already be doing our regular renewals, but at the unwinding, then we will kind of shift to our unwinding strategy. And so it depends on how much time that they give us prior to the unwinding. But once it starts, we'll immediately start doing renewals.
Okay, the next question, when do you anticipate the waiver of the Medicaid referral to end? I'm not sure I understand that question.
E14 waiver.
Okay, we'll let Gretel handle that one.
So the E14 waivers, actually, we requested them to start immediately. So those can start now, even before the unwinding. But at the end of the unwinding, they should cease. Now, there's a possibility they may let us continue them, but we would have to reapply for them at that time.
Kind of hard to balance. Let's see here. Any idea when the PHE will end? Our patients are asking. Great question. We're all asking that same question. We don't determine when the public health emergency will end. That is up to federal agencies through Health and Human Services or HHS. It's up to them to determine when that's going to end. And the Biden administration will work with them to let us know. We have been told, as Stephanie Azar, our commissioner, said at the beginning, that we would have 60 days notice. You guys will hear shortly after we do. Or you may find out the same time we do.
Okay, I see a few other questions. This question says, to confirm you plan to use the full 12 months? Yes. In order to be able to do the unwinding properly, we will need to use the full 12 months for the unwinding period. Has the qualifying income limit been updated since prior to the PHE? The income limits get changed every year. And that's a good question because in addition to the unwinding, usually in the month of December, we have something called the COLAs, the cost of living adjustments. And that happens to a number of different types of income. The income goes up, and then the Medicaid income limits also go up in what's called the FPL change, where the federal poverty level changes. So that causes us to have a lot of work that we have to do between December and around March, because when the cost of living increases, like in Social Security and other types of income, then we have to really go ahead and redetermine some of the income limits. And also, when the federal poverty level goes up, we have to hold those cases until the poverty level goes up. So that causes a lot of confusion sometimes to the recipients, and it is a time between December and March. So we really don't know what the income limits will be for until those changes take place. They have changed every year, and we expect them to normally change in December and in February or March for the federal poverty level changes. I hope that answers. In other words, the income limits will go up. So there are some people that we expect that they might not be eligible, and when those changes go into place, they will be eligible. So that does cause another thing that's going to happen to be in place.
Just doing a quick audio check. I understand that some of you are having difficulty hearing. Do we have any microphones in the room that are turned on? Make sure everything's turned off. Can you guys hear me now? Somebody put in the chat box if you can hear me okay. Okay, I'm not sure what was different, but something must have changed. So hopefully you can hear me now, and we'll continue moving ahead with our questions. To confirm, the EPSDT screenings are still being waived. Will needing a EPSDT referral begin when the PHE is over?
That's still under consideration.
Thank you, Barry Cameron. Deputy Commissioner said that is still under consideration, but correct, they do not need referrals during the emergency, but once the emergency ends, it's up for consideration whether it's needed or not. Thank you. Apologize for the audio issues we were having just a second ago. I think we were having too many microphones turned on.
There's another question about the telehealth regulations once the PHE ends. I think there are several different telehealth regulations. Our other Deputy Commissioner, Ginger Carmack, are you on the line? Are we correct in that those are still under considerations, Ginger?
Yes, ma'am. Yes.
Okay, thank you.
When we decide what telehealth will continue, we'll put that information out for comment before making it formal.
Okay, Ginger sounded a little bit muted, so she said that once they find that out, they'll put it out, put the information out.
Yeah, this exact subject is something the Commissioner and I spoke about just before this meeting started. We agreed that a lot of the questions that you may have about what services will continue after the pandemic is declared over, we will have meetings in the future where we will detail this and we'll talk in depth. But right now, we're not. That information is not ready to put out just yet. So thank you. Okay. Looking for more questions. Do we have anybody in the room that has a question?
We got a question.
Okay. Which one?
Behavioral health.
Okay. Who's going to answer? Okay, I don't have Dr. Danny Rush in the room. I hate to put him on the spot. I don't know that he's even on the call. We have a question. Was the dental PPE code D9110 extended as well? We will be happy to find this information out for you, and when we post the information online, we'll try to get that information out with the notes that go out online. So thank you. So absent EPSDT referral count against the patients allowed 14 visits, and patients aren't being told. So it looks like a statement there. How much notice will be given to pharmacies concerning the copayment changes for prescriptions? Currently, during the pandemic, recipients do not have to pay a copay. That's part of that FMAP increase where they maintain their continuous enrollment. They also do not have copayments for pharmacy or doctor visits. And that's part of those services that we talked about, what things will continue. And any notices that go out to providers, this is a good opportunity for me to explain where you get that information. Hopefully all of you are receiving provider alerts. These are official notices that come from the agency. And if you are an enrolled provider with Alabama Medicaid, you should be receiving an alert by email. They're sent electronically. If you're not receiving electronic provider alerts, you need to submit your email to Gainwell Technologies. That's our vendor who handles provider enrollment. Just call the provider line, and they can make sure your email gets added to the provider alerts. It's so important that you get those. They are posted to the website as well. The way you find that is to go to www.medicaid.alabama.gov, and you're going to select that first tab at the top that says Newsroom, and you'll see provider alerts or alerts as an option on the drop-down menu. I just ask that you please make sure that you're subscribed to those alerts, because that's how the most important information that providers need to know, that's how it's communicated, is through a provider alert initially. So any change to services will be communicated, especially copayments for pharmacy. Are the application assisters paid physicians? We already responded to that. No, they're not. How much notice will be given to patients or pharmacies concerning, that's the second. Looks like it was repeated, perhaps. What are a speech and occupational therapy office in Auburn, Alabama, or we are, excuse me. We have printed off the postcard, but could we get some yellow ones to put in our office? Yes, I'd be happy to send it to you. And I'm going to give you my email address. It's also on the screen. So if you join by phone only, if you'll jot down my email address, it's Melanie, MELANIE, .Cleveland, just like the city, at medicaid.alabama.gov. So just melanie.cleveland at medicaid.alabama.gov. I'll be happy to send you English and Spanish versions if you need those. We have them in both. If you have another population that speaks a different language, maybe several of your Medicaid recipients speak something other than Spanish or English, we'll be happy to try to get a translation for you and get it printed and get it to your office. All you got to do is just ask. Okay, any other questions? Is it safe to assume that currently eligible Medicaid recipients cannot be retroactively denied to any dates included in the public health emergency? Correct. Any Medicaid recipient who has had coverage, either qualified in March of 2020 or since then, once they're on Medicaid, they stay on Medicaid through the end of the public health emergency. Will the state's detailed unwinding plan be posted online or publicly available? Currently, we just have a communications plan available. There has not been a determination, to my knowledge, if there will be any other plans posted. However, if we do post them, they will go on that provider tab. The best way to go is to www.medicaid.alabama.gov. Click on the providers tab, and on the drop-down menu, you see COVID-19 information for providers. Anything we've gone over today, the slides, the copy of the recording of the presentation, all of this is going to be on that particular web page. So any new information to the toolkits or any new plans, those would all be posted on that page when they become available. And most likely you would see an alert come out to providers as well. For all your attention, thank you for just being a part of the meeting today. And if there's any further questions that come in or that you think of, feel free to send me an email. And if it's for Gretel, I can forward it to Gretel or any of our other staff. So thank you very much. Have a great day.